Hi, this is Dr. Kursbergen, and welcome to Aeromedical Solutions, and good afternoon. So today I'm going to talk about the differences between first, second, and third class flight physicals, as I get this question from time to time. First class, typically you'll see commercial airline pilots. Third class, you'll see individuals who are just trying to learn how to fly on their own or just have fun with that. And second class are in between those different regions. So the distant vision typically is one of the primary concerns and differences between first, second, and third class. First and second class both are required to have a 20/20 or better in each eye vision. You can do this with or without correction. So if you are not 20/20 at this point with your vision, there's no big deal. You can absolutely go and get checked and get in appropriate glasses for your supplementation to reach 20/20. There is a difference, however, with third class flight physicals. You only need to be required to do 20/40 or better in each eye separately or with or without correction. Now, near vision is for all of them the same 20/40 in each eye separately, or basically what we call a Snellen equivalent. This is with or without correction as well. The intermediate vision is not checked on a third class flight physical, but it is checked in the first and second class. You are required to do about 20/40 or better in each eye as well. This is with or without correction at the age 50 and over, and is measured at 32 inches. Your color vision is another vision test that we do perform. It's the ability to perceive those colors differently, to be able to identify when you're flying. Obviously, that's important to identify those differences. I typically use the Ishihara plates. So you look at a circle and you tell me what is the number, letter, etc. that you see in the middle. Hearing is important as well. If you're an air traffic controller, we do audiology testing. If you're a flight physical, we typically do conversation testing. If you do fail that, then audiology is important. And typically that's within a 6-foot range there. All your other examinations reveal that for ear, nose, and throat, we do not want any ear diseases or conditions that would be manifested, especially when you're flying. So we do check out your head, ears, eyes, nose, throat situation when you come into our clinic. Your pulse is not disqualifying per se. If you do have a significant tachycardia, which means rapid heart rate, or significant bradycardia, we will have a discussion about that. But in general, most people fall within a very good range there. Blood pressures. There is no specified value stated in the standards. However, the current guideline maximum is 155/95. I know that when many people come and see me, their heart rate's a bit up, their blood pressure's a bit up, and I totally understand that. I let them relax, chill out, maybe get a drink of water, and that tends to resolve. If it is a consistent issue and you do require medical management, no issues there either. There are many medicines that are approved by the FAA. Your ECG, or electrocardiogram, this is the function of checking electricity in your heart. I always tell my patients that there's two functions of the heart. One is a plumber, the ability to pump, and one is an electrician, which is your electrical activity that we follow on an electrocardiogram. You do have to have an ECG or electrocardiogram at the age of 35, and then annually thereafter at the age of 40 and up if you're first class. Anything less than that is not routinely required in second and third class. Okay? There are a few things that will not allow you to fly, to include specific mental conditions. And those mental conditions are no diagnosis of psychosis, bipolar disorder, or severe personality disorders. If you do have those, it would require specific further evaluation to ensure that that is your accurate diagnosis, but there is a very restrictive environment in terms of those diagnoses in general. Substance abuse, substance dependence, that is another area of specialty for my clinic. We are very specific about our follow-ups with HIMSS, which means that you come in, we do our consultation, we evaluate what the root cause, when it happened, how it happened, and I give you a couple pages of things that we have to complete. The diagnosis or medical history of substance dependence is typically disqualifying unless there is an established clinical evidence which is satisfactory to the FAA of recovery, including sustained and total abstinence from the substance for no less than the preceding 2 years. A history of substance abuse the preceding 2 years is disqualifying. So substance includes alcohol, other drugs, PCP, sedatives, hypnotics, marijuana. I know it's legal in some areas, but it's not legal for the FAA. Cocaine, opioids, amphetamines, hallucinogens, or any other psychoactive drugs. There are specifically some disqualifying conditions unless otherwise directed by the FAA, and I do like to provide you that information. There are many things that we can go about. We can talk to them, we can do a special issuance, we can have further follow-up, we can have specialists look at you, but these are the specific FAA disqualifying conditions that require, a deferral to the FAA. One is diabetes, requiring hypoglycemic medications, which means your blood sugar falls too low, angina pectoris, which means unstable chest pain, coronary heart disease that has been treated or if untreated has been symptomatic or clinically significant. Basically, you're still having the chest issues of your heart. Heart attack, unless followed up, cardiac valve replacement, unless of course followed up in special issuance, heart replacement, which is reasonable, psychosis, bipolar disorder, personality disorders that are severe enough to have repeatedly manifested in overt acts, substance dependence, substance abuse, epilepsy, a disturbance of consciousness without satisfactory explanation or cause, and transient loss of control of your nervous system without satisfactory explanation or cause. So those are specific disqualifying conditions. However, we work with you in general to try to see if they are truly your diagnosis, if there does need to be follow-up, and how that follow-up needs to be performed. If you are interested in any further information, go ahead and check us out at aero-md.com, aero-md.com, or call our clinic, come in and visit us. We do also have, I just want to put a little note in there, a secondary clinic for our aviators. It's called Aeromedical Wellness. We perform hormone replacement therapy, IV therapy, weight loss management, as well. We have specifically consult care with urgent care for only the pilots that attend our clinic. So if you have any questions, you can also check the aeromedicalwellness.com website. So there's two, one specific for aviators, aero-md.com, as well as Aeromedical Wellness. Thank you and have a great day.